Everyone. I think we can get started. It's exactly 12:30. So thank you so much for joining us. My name is Melissa Pennell. I am the Director of Member Engagement at the AMA, and I will be your moderator this afternoon. Before I turn it over to Dr. Duggan and our physician experts, I'll just take a minute to read the AMA's Land Acknowledgement Statement. Next slide, please. Thank you. The AMA respectfully acknowledges that we are privileged to live and work on the traditional lands of diverse, distinctions-based Indigenous peoples, including the Anishinaabe, Dene, Nahiawak Cree, Niitsitape Blackfoot, Otopimisawak Métis, Sioux Nakota, Stoney Nakota, Tsuut'ina, and more. This land has been gifted with many names, including Treaty 6, 7, and 8, the Métis Nation within Alberta, its Otopimisawak Métis government, the 8 Métis settlements, and its Métis Settlements General Council and the homeland of the Métis. The AMA honors the vibrant histories, languages, and cultures of the First Nations, Inuit, and Métis peoples of Turtle Island, now known as Settler Canada, who came before us and continue to thrive here today. Next slide, please. So this is just a quick slide to remind you of our panel members today. Dr. Duggan will kick things off, and then we'll have a few comments from each of our experts who are with us. With that, I will turn it over to Dr. Shelley Duggan, President of the Alberta Medical Association, to get us started. Please go ahead.
Thanks, Melissa. Good afternoon, everyone, and thank you for being here today. Alberta is facing a growing measles emergency with outbreaks reported in every health zone. As of May 7th, the government dashboard confirms 297 cases, and hospitalizations suggest that that true number is even higher. There is now agreement province-wide that we need to drastically increase the number of Albertans vaccinated against the measles. The AMA and many others have been speaking out. Government has stepped up and will be launching an advertising campaign. We know there is still a lot of confusion and sometimes misinformation, and it can be hard for families and parents and caregivers to know the risks and who should be first in line to get those vaccinations. Today, we have gathered some physicians who are well known in Alberta and even across the country as experts who can guide the public. I'd like to introduce Dr. Tehseen Ladha, who's a pediatrician, Dr. Lynora Saxinger, infectious disease specialist, and Dr. James Talbot, a public health physician and former chief medical officer of health. Each one will speak for about 5 minutes, and then I will be back to ask some concluding questions. We'll then open up for questions from you. Before I go to our panelists, I just want to share some quick facts. Measles is the most contagious illness in the world. It's a virus that spreads easily through the air, and you can get it by passing through a room or area where an infected person was present for up to 2 hours before. Symptoms include fever of 38.3 or higher, cough, runny nose, red eyes, and a rash that appears 3 to 7 days after fever starts. Usually begins around or behind the ears and face and spreads down the body. The rash is often red and blotchy on lighter skin, but on dark skin colors, it can appear purple or darker than the skin around it, and it can be hard to see. It's important to remember that the measles is contagious 4 days before the rash appears. Complications can be severe and life-threatening and can include neurologic damage, hospitalization, and death. Children under 5, particularly those between 6 and 12 months, are at highest risk of these outcomes. Anyone who hasn't had measles before or is not fully immunized is at risk of getting the disease. If you have measles symptoms or think you have been exposed, please stay home and call HealthLink at 811 before visiting healthcare facilities or providers. The measles vaccine is safe, and it's the best way to protect against it. It's highly effective at preventing infection and complications and is much safer than getting the disease. If you were born before 1970, you are likely immune, as you were probably exposed when measles circulated widely. I'm now going to turn the microphone over to Dr. Ladha to give her perspective as a pediatrician.
Thank you, Dr. Duggan. So when measles hits a population, the group we worry about the most is the children. Children are uniquely vulnerable to measles. First of all, they don't usually get immunized until at least 12 months of age. And secondly, as we heard, they have high risks of serious illness and hospitalization. We worry about those under 5, and particularly those under the age of 1, who can have quite severe outcomes if they do get measles. And some of these outcomes, as we heard, can be things like dehydration and pneumonia, but in other cases, children can get brain inflammation or encephalitis from measles. And this can cause long-term disability in those children. So we're looking at children having blindness, seizures, brain damage, lasting effects from contracting the measles virus. And if we look at the rates of hospitalization of measles in children, we can see that they're relatively high. So between 10 to 30% of children that contract measles will be hospitalized. And we see proof of this in the US. The recent outbreak in the US, the hospitalization rate has been about 20%. And to put this in perspective, if we look at another virus in children that can cause harm, so the RSV virus, the hospitalization rate in the most vulnerable group, so those under 6 months, is closer to 2%. So a drastic difference that really shows us the seriousness of measles. I think we can also see that measles is very serious by the fact that there are already 3 people in Alberta that have been hospitalized in the ICU with the measles virus. And unfortunately, there's no known effective treatment for measles, but there is a safe and effective measles vaccine. I see families in clinic and they want to discuss the measles vaccine, and I empathize with them because there is a lot of false information out there, and they don't know what to believe. And I know that they want to do what's best for their children. I want to reassure those families that the measles vaccine is safe. It has been thoroughly researched. It has been around for decades, and side effects continue to be monitored. Most children have minimal side effects from the vaccine, and it's also a very effective vaccine. So 1 dose of the vaccine gives your child 85 to 95% protection in preventing them getting measles, and 2 doses gives almost 100% protection in getting them measles. So I highly encourage families who have not immunized their children to really prioritize this before they get an exposure. And we heard earlier this week that the government has opened up vaccination to 6 to 12-month-olds in certain areas of the province. Take advantage of this. Get your babies immunized before they are exposed to prevent some of those devastating consequences that we've discussed. As we heard, measles is extremely contagious. It has spread very quickly in Ontario, for example. The outbreak in Ontario is currently larger than the outbreak in all of the United States. And Alberta is likely headed this way given our low immunization rates. As pediatricians, as healthcare professionals, on top of our mind too, is that we want the best interests of your children. We want to keep them healthy. We want to keep them safe. How do we do that? In this context, in this situation, the best way to do that is to get them the measles vaccine. Thanks. I'm going to hand it over to Dr. Saxinger.
Dr. Duggan, you're just on mute.
Thank you, Melissa. So Lynora, Dr. Lynora Saxinger is an infectious disease specialist, and she's our next speaker.
Thanks. I want to pick up on something that has been mentioned already, which is misinformation, because what we've been seeing is that we can have an epidemic of a disease, but with that, we usually see a worsened epidemic of misinformation around the disease. And it is quite an organized misinformation campaign in the anti-vaccine area specifically. So I thought I would just offer out a second and talk about that. Misinformation is information that's incorrect. Disinformation is essentially misinformation put there for a reason, and this is actually a big business. People profit from disinformation campaigns, and they are increasingly prevalent on social media, especially. And honestly, I think we can all appreciate that's getting worse. The problem, I think, is that people don't necessarily have to go all in on believing misinformation about vaccines. They just have to hesitate. So if you see something frequently, you might start to accept that it might be true, and that's just a psychological fact. And if you're even a little bit open to believing in it, you might then just hesitate to make the vaccine appointment and not be sure what to do. And I think that's becoming more and more common. I think it's also a myth that, smart people don't fall for this, because lots of smart people fall for this. There are very smart, sophisticated people who get drawn into vaccine disinformation and conspiracy theories, which in fact are quite contagious as well. And they can come up with even smarter ways to justify believing in something that's not supported by real world evidence. So I think it's important for people who are approaching any of these topics to just be aware of misinformation and take some steps to protect yourself. So it's almost like vaccinating yourself against misinformation. People need to watch out for sources that seem very legitimate on social media. They can be very polished looking organizations, and they'll often quote experts that sound very expert and look very expert, but they're not actually experts representing experts in the field who are working in that area, specifically in things like public health and infectious diseases. So, fringe experts who aren't truly experts or are influencers instead. People need to look out for posts that might twist facts. Often there's some factual information that gets twisted or exaggerated, or gives tiny snippets of information that are taken out of context and use that to support their claim. Posts that actually invoke broader conspiracy theories are a big red flag. There's a large network of conspiracy theories, and things can sound very, very alarming, but are not reality-based. And essentially, any vaccine information that uses a shocking or tragic story or information is a potential red flag, because these posts will use emotion to bypass logical reasoning. And that's a really common gambit as well. So just saying that, as well as vaccinating ourselves against diseases, we should vaccinate ourselves against misinformation. And it's really important to recognize signs like this of poor quality information and use official information sources backed by real public health experts or physicians and people who are in the field in that area. And the other thing that we just talked about was measles in kids. I'm an adult doctor. I want to talk about measles in adults. So most of the people who are, 55 years of age and younger grew up in a world where measles was decreasing very quickly. And many of those people had one dose of vaccine because that was the recommendation at the time. A lot of those people are now at risk of getting measles, and measles in adults can actually be quite significant. It can be a very severe illness. It is, not just a rash, it's a whole body illness, as has been described. And people can get severe lung disease, they can get hepatitis. Encephalitis is more common in kids than adults. And, another big feature is that post-measles, people can have a period of relative immune deficiency and can be more prone towards other potentially significant infections. And then the final thing that I don't know if we mentioned is that there's a late complication of measles called subacute sclerosing panencephalitis, which actually occurs 7 to 10 years after getting measles, especially if measles was acquired by a young child. And this can be a fatal complication. It's a very tragic and fatal complication, and that is thought to occur in about 1 in 1,000 infected kids. And so there's a lot of kids at risk of these complications. For adults, the highest risk is in people who are, as I said, over 20, and also pregnant women and immunocompromised people. So with pregnant women, the risk is that actually you can have complications of pregnancy and you're more at risk of severe disease, including pneumonia. Complications of pregnancy can include low birth weight, stillbirths, miscarriage, and pregnant women are really best off if they're immune going into the pregnancy, which is why the blood test is done as part of the prenatal workup. And if people, or, verification of immunity. And if a pregnant woman is not immune and, is thinking about getting MMR, we usually don't recommend getting that during pregnancy. So it would be something that would be given after pregnancy. So what can someone do if they suspect they're non-immune and they're pregnant, or actually anyone who might be non-immune and exposed to measles? There is, part of the public health workup is letting people know where people might be exposed to measles. And if someone, self-identifies as having been potentially exposed to measles, and we do not believe that they're immune, they can be treated either with vaccination if they're eligible, or with, getting an antibody shot to protect them and prevent development of measles or severe measles. And so people should be aware that, if it's a little late to get the shot or you're not eligible for a shot, there's still protection available. And I think that, I want to talk about the complications and misinformation dominantly. And so I think I'm going to pass that off now to the next speaker.
Thank you. Last but certainly not least, I'm going to invite Dr. Jim Talbot, who is a public health physician and former Chief Medical Officer of Health, to speak.
Thank you, Shelley, for the opportunity to give a public health perspective to Alberta families. Right now, measles, as you've heard, is in all 5 zones in Alberta. And as a result of that, our children, our grandchildren, and family members are at risk. I just want to reinforce Tehseen's point that kids under 5 are most at risk of serious complications, and particularly babies from the age of 6 to 12 months, who until Monday were not eligible for the vaccine, and therefore every baby of that age has not been immunized. There are 3 reasons why we want Alberta families to move quickly on this. The first is that, as you've heard, measles is highly contagious and spreads very quickly. Secondly, because it takes time for measles to infect someone, cause symptoms, develop the rash, and be reported after a lab test confirms it, the numbers reported in Alberta are actually lagging behind the number of infections. And thirdly, the percentage of kids unimmunized or partially immunized is very high in Alberta. On average, the percentage of children under 2 who have received the recommended 2 doses of vaccine in Alberta is 68%. Those are the government's own figures. And that is considerably below the 95% target. It's worse in the north, south, and central, with coverage rates of 50% or less. And it's still not as high as we'd like in Edmonton and Calgary, that, however, they are in their 70s. So I want to move from that sense that we need to have families to move quickly on this, to what the actions are. So if you're a parent of an infant who's 6 to 12 months of age in the north, south, and central regions, you don't need to check for their immunization status. They're not immune. And you should quickly seek immunization. So don't wait, and use the contact numbers that the government has provided for getting those appointments. We urge the province, however, to make the vaccine available province-wide, not just to the north, south, and central, since all children in that age group are at special risk. If you have children between the ages of 1 and 5, you should check their immunization status, as we've already recommended. And if they are unimmunized or partially immunized, you should quickly seek immunization. If you have children under the age of 5 staying at home, then everyone in the home should know their immune status, because it is possible that you could either bring measles into the home, or you could end up acquiring it after your child is infected and you're taking care of them. So very important that everybody in the families of 5-year-olds and below are aware of what their status is. And again, you have a perfectly good solution of how to protect yourself and them. Indigenous children are in those age groups are at the same risk, and in fact, potentially higher, because they often are located in remote locations, and overcrowding due to underfunding allows the disease to spread more quickly. So we would really urge Indigenous leadership and the elders to continue to advocate to ensure that their children don't fall into the cracks between federal and provincial jurisdictions. If wait times are unacceptable, in your opinion, when you call to make those appointments, then we urge you to contact your local MLA and the Minister of Health, so they can be aware of where you are and what the delays are. And as a consequence, they can make sure that more resources go to your area to bring those wait times back to an acceptable level. And finally, if you're a healthcare worker in the province, you need to know what your vaccine status is and make sure that it's up to date, because it is very likely that measles will be coming to a healthcare facility near you. Thank you.
Thank you, Dr. Talbot. I just want to go back now to the panel and ask a few questions. And these are questions that we would often hear from patients and families. So the first question is about the link between autism and the vaccine. And I'm going to ask Dr. Ladha to comment on that.
So this is something that we have been hearing more of recently, with some false information spreading amongst our neighbors to the south, and also trickling here into Canada. And I want to reassure families that there is no link between the measles vaccine and autism. And so the way this myth began was due to a study published in the 1990s that demonstrated a possible connection between the two. However, this study was later found out to be fraudulent, and the author was found out to have falsified information for this study, and he did have to retract the study. Since then, there have been many studies done on this topic, looking at a potential link between the MMR vaccine and autism. Some of these studies have included up to 500,000 children, and none of them have shown any link between the measles vaccine and autism. So in fact, if you look at the rate of autism in vaccinated children versus unvaccinated children, there is no difference. So this link does not exist. I want to reassure families that, again, that this is a safe vaccine, and there should not be fear of a consequence of autism, because that has been disproven many times.
Okay, thank you. Another common question we get asked about is whether natural immunity can protect us from getting measles or from getting very sick from measles. Dr. Saxinger, what role does natural immunity play in defending against the measles virus?
I mean, I'm going to start by saying that I don't want to diss immunity that people have after being infected, because we actually see that people who grew up, well, if they survived childhood in the 1950s and 60s, they will be usually immune, and that immunity is lifelong. And so it is highly effective, natural immunity. And actually, we are also gifted with a vaccine that has some of the most potent and long-lasting immunity that we have amongst vaccines. And it comes without the risk of actually acquiring infection. So I think one of the problems is that natural sounds somehow healthy or preferred, but it really is genuinely not, because to get natural immunity, you have to be infected, and there are those risks that we talked about. And those risks actually do not depend on how healthy you are, and you cannot boost your own immune system non-specifically to prevent measles. I mean, it is the most highly contagious, serious infection that can cause long-term consequences that we have, like globally. It is the case study of contagiousness, and it will find people who are under immune if it is circulating in a community. And I think that, you know, the other thing that happens is people lump measles with a whole bunch of other, you know, less serious childhood illnesses that people consider a rite of passage. That is a mistake. It is a very severe infection, and we should not ever knowingly expose people to this infection. It is much better to be immunized.
Thank you. And the last question I'll ask is for Dr. Talbot. Are there any over-the-counter products, vitamins or supplements that can cure or prevent measles?
So the answer to that is no. And in fact, if someone is promoting a product, for instance, on the web, that says that they can cure measles or that they can prevent you from getting measles, they're either trying to sell the clicks on their website or they're trying to sell you a product. But what they're not doing is helping you protect your family.
Thank you. So as our experts have explained, measles is dangerous and highly contagious. Children are at greatest risk of suffering serious complications and even death if they catch it. There is a safe, effective vaccine to prevent these devastating outcomes. We are urging Albertans to protect themselves, their families, their little ones by making sure that they are immunized against measles. If you do not know your or your child's immunization history, text vaccine record to 88111 or call HealthLink at 811. We hope that your media outlets as reliable sources of information for Albertans can help to share this story. Thank you for coming and listening, and we hope you will pass this information on. That concludes our comments, and now Melissa will turn it back to you for questions.
Thank you. Okay, so as per usual, we'll move now to Q&A, and we'll conduct that using the hand raise tool in Zoom. So if you've got a question, just use that hand raise button, and we'll go in the order of hands raised. So we've got 2 hands raised just now. I did get an email from somebody who can't find that hand raise button, so we'll go in the order of Sean, then Ted, and then Catherine. So Sean, please come off mute and ask your question. And also, please just remember to introduce yourself and let us know what media outlet you're with.
Hi, I'm Sean Amato with City News. Thank you for doing this and for all the information you just gave us. I'm also looking for a report card of sorts on the government. The response about a month ago, I spoke to Dr. Talbot. He said the government was not doing enough. The government held a press conference on Monday and sort of acknowledged that they haven't been doing enough and they are going to step up efforts. So I'm just looking for a reaction to that. Did the government fall asleep on this? Are they now on the right path?
Yeah, I think, thanks for that question, Sean. And I think I really want to emphasize that the purpose of today's panel discussion is that we really want to inform Albertans what the risks are and how they can get immunized. I will say that we are very happy that the government has now started to speak up about measles. I think they understand that things are perilous right now and that we could start to see those numbers rise dramatically. And they are increasing immunization clinics. And what we hope to do is work with them to help inform the public and do whatever we can to urge Albertans to get vaccinated. So, you know, things are improving, I think is what we'll say. And we really want to use our time to inform Albertans what they need to do.
Thank you. And I think next up we have Ted. Ted, please go ahead and come off mute to ask your question.
Thank you, Melissa. I am the person who couldn't find the raise hand button, so I appreciate you getting back to me via email and getting me in the queue. My name is Ted Henley from CBC News. Thank you to everyone for all the information we've had so far this afternoon. I want to come back to the why for today, though. Because the province did hold a media news conference a couple days ago addressing the situation. There was a lot of good information in that news conference. But why did the 4 of you feel so strongly that you needed to hold a totally separate news conference, separate than what Alberta Health had organized a couple days ago? And I'm not sure who wants to address it, but this is to all 4 of you.
I'll start, and maybe I'll pass it over to Dr. Talbot. I think, you know, this is going to require a multi-pronged approach. This is a big problem, and it could get out of control quickly. The AMA, you know, is an organization filled with expert physicians who care what happens to Albertans. And this is work that we do and we will always do, and we will help amplify. And you know, we by no means replace public health. We just want to build on what is being done. But maybe I'll turn it over to Dr. Talbot.
Thanks to Shelley. Just to sort of develop further what the point that she was just making is that when we talk about public health, one of the things that public health has in its definition is preventing disease and injury through the organized effort of society. And so what the government was doing on Monday was sounding a warning about what was happening in the province. And then that message needs to be amplified to be able to get to every part of the province, people who have access to conventional media, people who are on social media. And so that requires organized effort of everybody. And I think the AMA has really stepped up to the plate for that. I also think one of the really important issues around having physicians speak out on the issue is that you have access to a brilliant pediatrician like Dr. Ladha and the equally brilliant adult infectious disease specialist, Dr. Saxinger, who aren't just experts because they study the literature, they're experts because they contribute to the literature, and they're really experts because they see the patients who have these problems, and they've been helping to treat them, to care for them. And that's a perspective that when you're trying to make clear to people that this isn't just a theoretical problem, it's real, it's in the province right now, and we already have 3 kids in the ICU, and that's 3 too many. They speak with real authority because of that background. So I think combined with what Dr. Duggan said, that's the answer to your question.
Lynora, you had your hand up. I don't know if you wanted to add anything.
Well, I think I'm known to be a bit of an evidence geek, and the evidence actually is also important to look at here, which is when you look at the declining trust of people across types of, resources, institutions, and individuals, that has been happening over the last 5 to 10 years, mostly over the last 5 years. Trust has been best maintained in physicians because people have a relationship with their physician and they have a personal relationship. They know who they are and they can trust advice coming from someone who's helped them before. And so I do think that, bringing together a panel of physicians is useful in addition to almost anything that's coming forth from any organization, be it political or media, honestly. Sorry, and not that I'm saying that distrust is warranted, but that capitalizing upon existing trust is also very important.
Thank you. So next up we have Catherine, and I'll just mention I had one other email from someone who also could not find the hand raise button. So we'll go in the order of Catherine and then Jennifer Lee and then Devika. So Catherine, please go ahead.
Yes, thank you. And for my media colleagues, it's under the react button at the bottom and there's a hand raise function. So my question is, in terms of the immune system, I'm wondering what measles does. Like, does it wipe out the memory cells? Does it go after antibodies? Does it just lower your overall defenses? What does measles do to existing immunity and your immune system?
I think, Lynora, that's for you.
This has been an observation that's been around for a long time. It was well known that you'd see severe, usually bacterial, but sometimes viral infections on the heels of measles, and that effect can persist, especially in kids. And I think that it's mostly to do with immune memory cells being affected directly. And it is a fairly long-lasting effect. It can actually be, months to even years when you're looking at immune system indices. I think practically, and Dr. Ladha might have comments, but practically a lot of the more severe complications are kind of closer after measles, but the persisting effects are thought to actually add significantly to the burden of mortality of measles, especially in developing countries. And so kids dying of other infections don't get counted as measles deaths, but they well could be. And so it is a really significant practical problem. And I think it's important to highlight it because physicians should be aware of this phenomenon, to be on the lookout and have a low threshold to manage kids who've had measles quite vigorously to prevent complications like that.
Thank you. And I think next up we have Jen. Please go ahead.
Thank you so much. And now I see the raise hand button. It suddenly appeared for me. Thanks everybody for chatting with us today. I have kind of a bigger picture question. Looking to other provinces, for example, Saskatchewan, BC. Saskatchewan announced more cases today, but they're still, I think, only around 27. BC, handful of cases. Ontario is another story. But I guess I'm wondering, how would you characterize the level of growth we're seeing right now in Alberta? And how that compares to other places in Canada at the moment?
I think that's a Jim question.
Thanks. That's a good question, Jennifer. I mentioned that there's a lag period between when somebody gets exposed and when it's reported to the province. And because of that, the most important thing is to look at the trend. And the trend that we're seeing, there's almost 100 more cases now at the end of the week than there was reported in the Monday figures that were given by the ministry. So that suggests, if you think of it like a hockey stick, we're on the shaft portion now. And you really want to try to do as much work as you can before you get to that period, because with more cases, it requires more effort. It puts more stress on the system, the people who are doing the contact tracing. And so, your best bet is to try not to get into that stage. Once you're into that stage, the most important thing to do is to get ahead of the curve by anticipating what's going to happen next and getting people protected before you get there. And so I think where we are right now is somewhere between Ontario and the other provinces. But depending on what the responses are and what the immunization rates are in those provinces, we could see different paths.
I just want to take a second, Jen, to also say that the importance of having people like Dr. Talbot, who is a trained public health expert, can give you that insight in terms of, we are kind of, the horses are already out of the barn stage. And so we're now needing to really, really ramp up the effort. And that's what a public health expert can bring to a situation.
I guess I wonder, I hope it's okay if I follow up here.
Yep, go ahead.
Yeah, thank you. Given all that, like, and given that you're here today to kind of get this message, like, how concerned are you about our ability to rein this in at the moment?
Jim?
I think we wouldn't be here if we weren't concerned. And I think the issue is that we're at 200 now. The way infectious disease works is exponentially. It doesn't work linearly. We saw that with COVID. And we're at 200 now. Statistics, some people have real problems because they remember their statistics courses from high school or university, but it can be pretty simple. What we've been saying from the very beginning, and what almost all the literature says, is that once you get to 1,000 cases, you can expect between 1 and 3 deaths, and in the same vicinity of serious complications like deafness or seizures or problems with mental development in the kids who've been most severely affected. And so we're here because we don't want to be in that situation. People like Tehseen and Lynora will have to take care of people who are in that situation. And if you've ever been in that situation, whether it's for measles or anything else, you know that your first thought is, I never want to do this again. And so that's where we are. Our concern is that we had an opportunity to make a difference earlier on. We're in a situation now where those opportunities have passed, and we're starting to see an significant increase in the disease. And when you add one more thing, which is that if you decide today you want to get any of the people we've talked about immunized, there's going to be a lag time where you get your appointment and come in and get your shot. And then your immune system takes anywhere from 7 to 14 days to kick in as well. So not only are we behind the curve in terms of the numbers that are being reported out, we're potentially behind the curve in being able to respond and get people as protected as possible. So that's kind of a long answer, Jennifer, but I hope that works for you.
Thank you so much. Devika, you're up next. Please go ahead.
Thanks so much, Melissa. Hi, I'm Devika with the Calgary Herald. I do have 2 questions that maybe I won't combine into one question. That'd be confusing. since the measles outbreak was first reported, are we seeing more Albertans come in to get the vaccine? How would you characterize current vaccination rates as compared to before the outbreak first came into play?
Do we have that information?
Well, we do. I mean, the province reported on Monday that they were seeing significant increase in uptake from the same time last year. So that's good. But I always find it helpful to have something about the magnitude of what we're trying to achieve in mind. And on average, as a lowball estimate, there are 50,000 newborns in the province every year, which means that between the ages of 6 months and 1 year, there are at least 25,000 children who haven't received any vaccine. And then, for ages 1 to 5, if the 68% is used, you can do the math as easily as I can. And so it's not just a question of whether or not they're getting an increase, it's which age group are we seeing the increase in, and is that making a significant impact in terms of decreasing the number of people who are vulnerable?
Right. And I suppose that would have been my follow-up question, but I'm not sure if this would be the right panel to ask that question to, if that's something I should be going to Alberta Health about. But yeah, just kind of looking at, what the uptake uptake in vaccinations have been. At this point, is it possible to say if that would have any sort of mitigating effect on how bad this outbreak could get, or is that too early to say?
Let me give you, because we don't know the details of the response and we don't know the funding behind it and the resources, let me just take it at a pretty straightforward level. During COVID, we were able to immunize really large numbers of people in a very short period of time. And that was with a lot of resources and a lot of people in the workforce to do it. So if we put enough resources into it and we immunized everyone who wanted their children immunized over the next week or two, and that was a significant portion of the people who aren't immunized, we would start to see the numbers plateau and within 2 or 3 weeks. Now, I don't know that that's humanly possible to do it that fast. And as I said, you have to wait until people's immune system kicks in. But this is something, I was asked a question yesterday of, is it too late to do something? And the answer is no. This is exactly the kind of thing that needs to be done. And the better we do it, the sooner we can bring this under control.
Thank you.
Thank you so much. Next up, we have Matthew. And I think Matthew will need to be our last question asker because we need to end at 1:15. Matthew, please go ahead.
Hi, Matt Skies. I'm with the Canadian Press in Calgary. I'm sorry, I had to step out for 5 minutes, so I don't know if this question's already been asked. But Shelley, you spoke to one of my colleagues about a week and a half ago or 2 weeks ago, and said something to the effect that you expected the trajectory to hit about 1,000 cases. Does that stand for you? And I don't know if you want to pass this off, just to get a sense for the trajectory we're on.
Yeah, I think what I was talking about is simple math, right? And so if you think about the fact that measles is highly infectious, that you are often infectious and exposing people without knowing it, and that potentially 16 to 18 people can become infected from one individual. And then you look at the low vaccination rates in populations. I don't think it takes someone with a PhD in math to really think about the numbers. So we're almost at 300. I think we're at 297 cases as of yesterday. And those numbers you can see are starting to jump up quickly on a daily basis, on a weekly basis. And so, even if you just did something simple like, let's say half of the 297 are still infectious and you multiply that by 18, right? Like you can start to see, if you just do the math and don't even consider other issues of population, how this could become 1,000 cases in a week or two. And I'll turn it over to Jim.
I don't think I have anything to add. I thought that was a brilliant way of making the the potential impact of this clear. I would point out that, which I didn't extend, that, you know, if you get 1 to 3 deaths per thousand every 1,000 cases, you're continuing to pay the price. It doesn't end with the first 1,000. That's the bill that you pay for every 1,000, and that's why prevention is so important.
Thank you so much for that. All right. Thank you everyone for joining us today. As always, if there are any follow-up questions, please do reach out to media@albertadoctors.org. Thanks again for your interest and have a great afternoon, everyone.
Thank you.